Hi, everyone. I'm really sorry about that. We had some technical difficulties. I hope that you can all hear me now. I'm going to start over, okay? Thank you so much for joining me for our second LDNdoctor.com live webinar. Due to such positive responses from our last webinar, we decided to hold a webinar with a detailed look at the benefits of using LDN for a specific condition. Today, we will be talking about hypothyroidism, delving deeper into treatment strategies. At LDNdoctor.com, I have the privilege of meeting patients from all over the US with many different complicated health issues. I feel so lucky to have LDN to offer. LDN has been such an effective and easily tolerated tool for so many different health issues, including inflammatory bowel disease, multiple sclerosis, fibromyalgia, depression, anxiety, chronic fatigue, autism, and more. A large percentage of my patients at LDNdoctor.com suffer from symptoms of hypothyroidism, including fatigue, brain fog, constipation, and weight gain. Because hypothyroidism is something that I see in my patients on almost a daily basis, I decided to do today's webinar on this complex and common issue. Also, I wanted to address hypothyroidism specifically, since so many of my patients are diagnosed by their physicians, but don't feel a relief of symptoms with typical thyroid medications. Let's start with some basic information. The thyroid gland makes hormones that affect every cell in the body. It plays a role in reproduction, proper growth and development, and it maintains body temperature, metabolism, and affects heart and brain function. Thyroid disorders range from an underactive gland that does not make enough hormones to an overactive gland that makes too many hormones. Hypothyroidism is a condition diagnosed when the thyroid is underactive. Hyperthyroidism is diagnosed when the thyroid is overactive. Hypothyroidism is the most common thyroid disease. It is estimated that up to 2 out of every 100 people will receive the diagnosis. Women are 10 times more likely to develop it than men. And the most common cause of hypothyroidism worldwide is a lack of iodine in the diet. Iodine is a mineral that is essential for thyroid function. Signs and symptoms of hypothyroidism include fatigue, constipation, weight gain, memory problems, dry skin, cold intolerance, decreased concentration, depression, coarse hair or loss of hair, irregular or heavy menstrual periods, and infertility. Hoarseness, muscle pain and tenderness, goiter, which is an enlarged thyroid gland, slow heart rate, low body temperature, slow metabolism, and so on. There has been some debate in recent years over the diagnosis of hypothyroidism. Traditionally, diagnoses have been achieved when blood tests for TSH, or thyroid stimulating hormone, are elevated, and T4, which is a hormone produced by the thyroid gland, is low. However, some patients seem to have symptoms even though their TSH and T4 are in the normal range. To address this issue, the normal ranges for TSH have been adjusted in the past decade. Also, a new category of disease called subclinical hypothyroidism has been created. This diagnosis is made when a patient has normal blood tests, yet seems to have a thyroid gland that is not functioning correctly. Good medical clinicians, integrative physicians, will look at each patient as an individual. They will base their treatment recommendations not only on lab work, but also on the symptoms you report. Now, let's get a little more technical. When your doctor orders a TSH test and nothing else, it really does not give us a full picture of your thyroid health. it is really very important to also check for free T3, free T4, and if there is abnormality, then to check thyroid antibodies to look for Hashimoto's, an autoimmune disease of the thyroid. TSH is released by the anterior pituitary gland in the brain and stimulates the thyroid to release T4. T4 is then converted to T3 by the liver. Now, here's the key. There are several important factors that impede T3 from functioning optimally at the level of the tissues. These important factors that impede T3 are high estrogen levels, low progesterone, testosterone, high and low cortisol, and there are many environmental causes of low T3, including low zinc, low selenium, heavy metal toxicity, liver dysfunction, hormone imbalance, and other vitamin and mineral imbalances. Low T4 can be due to iodine deficiency, fluoride exposure, bromide or chloride toxicity, as well as hormonal imbalances. That is a very brief summary of all of the possible causes of hypothyroidism. You should also know there is recent research pointing to gluten as having a negative impact on thyroid health as well. Now let's talk about what is generally done to treat hypothyroidism. The first thing I do is recommend that my patients get checked for thyroid antibodies, as well as for iodine deficiency and fluoride, bromide, and chloride toxicity. There is a lab I use often that is affordable and reliable. If I see that there are issues with low iodine, I recommend supplementing. And if there are issues with iodine toxicity, I recommend investigating the source. I also recommend supplementing with selenium, as there are clinical studies that show that selenium supplementation is essential for thyroid health. In fact, eating 2 Brazil nuts per day gives you all the selenium you need. One study showed that selenium is helpful in decreasing TPO antibodies. Next, I recommend a gluten-free diet, as well as avoiding all GMO foods. I recommend lots of raw vegetables, and we know that vitamins are essential for thyroid health, especially vitamin A. Finally, let's talk about medical treatments for thyroid. Until recently, I have been using Nature Thyroid or Armour Thyroid instead of levothyroxine, due to the fact that Nature Thyroid and Armour Thyroid contain both T4 and T3, while levothyroxine is only T4. However, I've recently changed my treatment strategy, and I often prescribe LDN before I prescribe thyroid hormones. I often see that after starting LDN, there is either no need for thyroid hormones or a reduced need for thyroid hormones. I have many patients who come to me through LDNdoctor.com who are on thyroid hormones. Many are on Nature Thyroid and Armour Thyroid. However, they continue to experience hypothyroid symptoms. And often these patients' thyroid symptoms resolve once they start the LDN. LDN is very effective at both improving symptoms of hypothyroidism and improving actual thyroid function. Often, within a few short weeks, thyroid hormone levels improve and antibodies decrease. Now, LDN is effective at both improving all these symptoms. And today, I'm going to be addressing some of your questions about LDN and treating the thyroid. So here are some questions that have come in. Joe sent in his first question. If I'm taking thyroid hormone, should I start LDN at a lower dose? Okay, thank you, Joe. Typically, yes, we usually start at a lower dose, and after a few weeks, you can retest your thyroid hormone level and TSH and see if it's time to reduce the dose of thyroid hormone. Once that is done, the LDN dose can be increased and this process repeated. Our next question is coming from Rebecca. Rebecca wants to know, how long will it take for LDN to have a positive effect on my thyroid function? Okay, great question, Rebecca. Typically, patients feel some benefit in the first week to 2, and this benefit can increase over time. So long as there have been some benefit felt or shown with blood tests during the first 6 weeks of LDN treatment, it makes sense to continue taking LDN. Our next question here is from Kathy. If LDN works, will it enable me to discontinue my thyroid medication? Sometimes this does happen, but you have to remember, the longer someone has been taking thyroid medication, the less chance that the thyroid can fully recover its normal function. Our next question is from Sue. Which test would you recommend I undertake and when in order to assess if LDN has been helping me? So I recommend testing TSH, free T3 and free T4. And if there were elevated thyroid antibodies in the past, also rechecking thyroid antibody levels to see if they have also decreased. Robert wants to know, my endocrinologist doesn't know about LDN and doesn't want to prescribe it. How can you help me? I often see patients through LDNdoctor.com's online system who can't find a doctor who would give them LDN. I can help you with assessing your health history, and I can help you in deciding if LDN therapy is suitable to try. And if so, I will prescribe it. You can continue working with your endocrinologist, and once your doctor sees the improvement in thyroid function, he or she may be willing to adjust your thyroid medication as needed. Okay, I see here we're running out of time, and I'm sorry for that delay in the beginning. So let's just answer one more question here. There's a question here from Angela. She wants to know, is it okay to take Imodium while you're on LDN? So this is actually a great question. Imodium is actually in the opioid family, and all opioids should be avoided while taking LDN. So I do warn my patients not to take Imodium while taking LDN. Thank you all for watching. Don't forget, you can rewatch this webinar anytime you'd like by using the same website URL. It will also appear on our website at www.LDNdoctor.com and on LDN Doctor's Facebook page. I hope I was able to provide you with a better understanding of hypothyroidism and how LDN is used to manage it. If you or anyone you know are interested in starting LDN or you need a refill, I'd be happy to help you. Just go to www.LDNdoctor.com and schedule an appointment. Okay, enjoy the rest of your day. Thank you.